Peter Caplan.
Thank you, Gary. And I'd also like to thank her, the staff, the network, and congratulations to all the honorees today. Can everyone hear me? Is this coming through? Okay. Okay. By quick show of hands, how many clinicians do we have in here? A couple, all right. How about administrators, healthcare administrators? Okay. Well then, we're going to have an interesting conversation today. By show of hands, how many people have heard of telemedicine, telehealth, or mHealth? Okay, so a lot of you have heard about what telemedicine is. Well, what I'm going to do is I'm going to go through this, let's see, where are we here? Okay, some very quick working definitions about telemedicine. For some of you who may not be able to see this, all of my materials will be available. Just contact the staff. They can provide you with this PowerPoint. And since we may be limited for time at the end for questions and answers, I'm happy to chat with anybody who may be interested in finding out more about what we're hoping to do. But telemedicine, very simply, is the use of electronic communications and information technology to provide clinical services when the physician and the patient are not in the same place. Telehealth is a little bit of a broader concept which incorporates not only telemedicine, but things like distance learning, consumer outreach, video conferencing, store and forward, patient portals. All of these things are incorporated into telehealth. Again, it's a slightly larger conceptual term than telemedicine. Telemedicine traditionally has been typically between doctor to doctor or hospital to hospital, but in the last several years there's been a growth of direct-to-consumer telemedicine where you can, in your home, you can contact doctors for direct care. And then mHealth is the last term, which has become somewhat common in the last few years. It's really basically the application of mobile technology to patient health care and patient engagement. So these are the terms that we're presently working with. Let's go this way. Telehealth. Why the need for telehealth? Why is it such an important concept? And I want to say that the terms telemedicine to physicians has somewhat been off-putting because it tends to imply some other form of healthcare, a specialty. The reality is, in my world, what we're trying to do is eliminate this whole notion of tele-anything, and what we're really talking about is clinical care using technology. It is nothing more than another tool set for clinicians to provide care. So ultimately, as more and more technology becomes pervasive throughout the healthcare system, this is just another tool. So, the reason that we have telemedicine growing is because we have a growing population, 360 million people projected by 2030. Many of you already know that there's going to be a fairly substantial physician shortage, so access to care is going to be much more difficult, especially for some of the Medicare and Medicaid population. There's a rapid increase in the number of older Americans coping with chronic disease, and because of the medications and some of the therapies out there, more of us with chronic conditions are living longer. So we have to be able to help maintain that level of care, and technology is one means to do so. There's a lack of access to medical services in many parts of the country, especially in rural or remote communities. There's an explosion in the technology. 10 years ago, broadband communications was expensive and it wasn't generally available. Video conferencing capability was expensive. In the last 5 years, all of that, the costs have come down dramatically. And so now it's very easy for physician offices, hospitals, clinics, even consumers to have broadband capability in the home, and then video conferencing technology is very inexpensive. Many of you may have already used Skype. Cisco has a consumer product called Jabber Video. All of these are inexpensive ways to provide video conferencing in your home. And then there's also a growing provider and consumer population that is comfortable with the technology. When I first started doing this 20 years ago, physicians were very intimidated by technology, and so they were reluctant to use it. But with younger docs coming out now and older docs retiring, the comfort and of using this technology is growing. And so more and more we have doctors who are very comfortable with it. Okay, there are some very basic challenges to telemedicine, and these challenges have existed for 20 years, 25 years. Telemedicine had its start essentially in the early 70s with both radiology, and now it's very common for images to be sent telemedically. But we also had distance mental health services. So it's still, we're still having adoption issues. And then there's also network infrastructure and equipment device. Even though it's less expensive, more readily available, it still creates workflow issues. And that's, we have EHR or EMR integration, where we are taking telemedical services and incorporating it into the EMRs. Reimbursement, we're now at a point where most of the states in the country are providing reimbursement. Most payers, private payers and government payers are reimbursing for telemedicine. It's still not where it should be, but we're getting more opportunities to pay for this. Licensure, credentialing, privileging, interstate licensure. If you're doing telemedicine across state lines, it gets more complicated, but within the same state, it's typically very easy to provide. Malpractice covers that for most doctors. Credentialing, any doctor who's licensed and certified can provide telemedicine. And then privileging at the facilities where we're going to be doing the consults. So these are some of the challenges. Mid-levels, we use a lot of nurse practitioners, physician assistants to provide some of this care. And then it's provider and patient engagement, getting people to adopt these technologies. But they're now becoming so easy to use that doing this is fairly straightforward. Let's go this way. All right. The typical telemedicine patient profile, we're normally looking at rural or remote communities. That's what it was initially designed for. But the reality is there are a lot of urban and suburban populations that are underserved. And because of the limitations in reimbursement with Medicare, they will not reimburse for anything that's within a metropolitan area. It has excluded a lot of the urban poor. And this is something that we're trying to correct. There's been a lot of discussion about extending telemedicine to the urban population. Medicare and Medicaid. Medicare will pay for telemedicine in rural communities, but it's limited. Medicaid patients, it's basically every state has to decide what they want to do. New York is now developing some telemedicine policies, and we'll talk quickly about that. Chronic disease patients, these are people that we can generally serve very well. We can engage them in very easy manner to get them to take responsibility for keeping on top of their condition. Recently discharged patients, one of the big challenges in healthcare is readmission of patients within 30 days of discharge. That becomes a financial risk to both the hospitals and the doctors. So what we're trying to do is do home health monitoring, where we can keep track of patients complying with their care plan, and that way we keep them out of the hospital. And then routine follow-up care. I recently moved here from Colorado. We have patients that would travel hundreds of miles to see a doctor for a 20-minute follow-up visit. Totally unnecessary if you have telemedicine. Most care can be delivered telemedically, remotely. These are a list of basic services that we now offer through telemedicine. The first is primary care, evaluation, diagnosis. So doctors in a rural community have the equipment turned on, they bring their patient in, there's a specialist at the other end. That specialist can see lab results, imaging, and so on, and then have access to the electronic medical record. Mental health and telepsychiatry, huge. All across the United States right now, telemental health is one of the fastest growing applications, something that I'm actually working on here with Upstate Medical. They have a successful telemental health program, and now we're looking to expand it across the entire state of New York. Diabetes and obesity management, we talked about nutrition and diet counseling. This is one of the big areas. There's a very successful endocrinologist at Upstate, Dr. Ruth Weinstock, who for many years has used telemedicine to educate and manage her diabetic patients. It's a very helpful tool. We have trauma care, tele-ICU, dermatology, cardiology, pathology. Virtually everything can be done telemedically. School telenursing, very important opportunity. Many schools don't have nurses, so we put in equipment and we can bring a nurse into a school. Nursing home and assisted living, telehome care. More and more now, patients are buying equipment to essentially monitor themselves in their home. You can buy scopes, stethoscopes, blood pressure cuffs, glucometers. All of these can be plugged in or wirelessly uploading information so that we can be monitoring people as a means of keeping them independent, living in their own home where they need less care. And then public health surveillance and community health education. Nationally, there are over 200 telemedicine projects across the country. Many are being funded through various Department of Agriculture, FCC. There are half a dozen major grant programs that have poured hundreds of millions of dollars into telemedicine over the last 20 years. A lot of it is to subsidize broadband so that communities, small communities, can have the infrastructure sufficient to be able to communicate and share information. More than 50% of the hospitals in this country are now using one type of telemedicine. Right here in central New York, Upstate Medical Center, they're doing their telemental health, telepsychiatry, they have a diabetes education, and they also have a telepathology program. I'm also working with the University of Rochester. They've had a very successful school-based telepediatrics program. They work with primary care doctors in schools to monitor kids if there are problems in the schools, and this is also part of the telenursing program. And they're also looking at doing teleneurology, telestroke. Telestroke is probably one of the most cost-effective programs that's been introduced in the last half a dozen years. It provides the opportunity for patients who need to get a life-saving drug, TPA, to be able to have that because it requires a stroke neurologist to be able to make the proper diagnosis. Also, Fort Drum and the North Country, the Action Network, are two FCC rural pilot projects right here in central New York. They're now building out, they have their network already built. Now what they're trying to do is provide clinical services. Basically, to do a telemedicine project, it's not as simple as just giving doctors equipment and saying, here, make it happen. Telemedicine project development, basically what we do is we look at what's the demand, because what we have to do is aggregate demand across an area so that there's enough business, enough volume of opportunity for specialists to commit to doing this. Right now, doctors are typically concerned about technology disrupting their workflows, and so what we have to do, my job primarily, is to build a sustainable business model that incorporates telemedicine into an efficient workflow. We have to find willing providers. Not every doctor, not every clinician is really willing or motivated to do telemedicine. We have to educate them about what the opportunity is to support their patient. And this is important because now patients are demanding more service, better service. Define the services that that we want to offer. There are a lot of things that we can be doing, but you can't do everything all at once. So the idea is to prioritize and to look at what are the services that really need to be available, and we can also model that. Looking at the sustainable business model. Most telemedicine historically has been grant funded or has been somewhat reimbursed, but right now the challenge is to build a revenue model that allows clinicians to earn an income sufficient to offset the cost of doing this as well as make it viable for the office to have the equipment. We want to look at prospective vendor partners, and I'll just share with you briefly one vendor that's really exciting. We have to create a user group. We have stakeholders involved. Everyone in this room is a stakeholder ultimately in the community. And so what we do is we build user groups and stakeholder groups so that we can really have a tremendous buy-in. We need project champions, clinicians, administrators, IT people. Everyone works together. We have to design orientation and training programs not only for the clinicians but for patients so that they understand what telemedicine is. In Colorado, we used to have a lot of senior citizens. The women who would come for a telemedical exam would do their hair, they put on makeup because they're on television, they're on TV. So they enjoy the opportunity to be able to interact. It's usually from a patient standpoint, great satisfaction in the services. And then monitoring clinical outcomes and patient-provider satisfaction. In order for these programs to be successful, we have to look at what we're doing. We have to decide what are the benchmarks that we're going to measure our success against clinically, financially, technology-wise. So those are some of the challenges that we have. This is one of the most exciting new vendors, and this is actually an opportunity here in Auburn. I'm working with this company to look at putting this kiosk, and if you can see, this is a self-contained unit. You step in, there's a console here, the doctor comes up immediately. All of these are different monitors that are available for him to or her to get information, your metrics, your blood pressure, blood sugar, all of that. This entire kiosk with all the devices in it are about $15,000. We're looking to put these into employers, into schools, into hospitals where this can be a triaging tool so that people don't have to go to the emergency room. They can go and have this. It's a $60 visit cost, which is hundreds and hundreds of dollars less than going into an ER. About 60 to 70% of the reasons that people go to the ER or a primary care doctor could be resolved with a telemedical visit. And for those of you who can't maybe see this, this is it sort of sums up what a lot of people think of telemedicine, which is basically there's a doctor sitting there, he has his phone on the table with his stethoscope up to the phone, and he's telling his patient, now inhale deeply, Mrs. Saunders, and he's listening through the telephone. As humorous as this may be, this is actually what telemedicine is. And what we've essentially done today is we've eliminated essentially the phone and we've turned the stethoscope into the phone. So a doctor sitting in Syracuse can listen to your heart beating here in Auburn or anywhere. And right now, all of the major healthcare institutions across the country, Mayo Clinic, Cleveland Clinic, MD Anderson, all the big names, Johns Hopkins, I could go on, the list is enormous. They are doing not only statewide telemedicine, they're doing national telemedicine, and for many of them, they're doing third world. Johns Hopkins is in the Middle East. You have a number of organizations that are doing Central America, South America. It is huge in the third world. And primarily because there's no infrastructure to support traditional medicine, they bring telemedicine in to support rural communities, doing basic health education, health screening. I promised Irv I'd have everything done by about 1:25. I do have a couple of minutes. I went through this very quickly. I'm happy to be available to anyone if you should want to talk about telemedicine for your organization or for people that you work with. I will take a couple of quick questions if there are any. I guess I was really good. Yes?
So what are the privacy concerns related to telemedicine that they can
Thank you. That's a very important question. For several years, I was a HIPAA consultant. For those of you who don't know what HIPAA is, it's basically the government's privacy and security legislation to protect us. Telemedicine, like any type of interaction with a physician, is covered under HIPAA. Any of the information that is derived from these telemedical consults is supposed to be secure and private. So it doesn't, I mean, the general security of healthcare right now, for those of you who follow some of the press, there's been any number of breaches out there, and sometimes your health information gets compromised. But it is subject to all the, and prior to doing telemedicine, we always do a security analysis to make sure that we don't have any vulnerabilities in the transmission. Typically, all telemedicine is secure. You can't really do it over Skype. It's not something that you would do over Skype, but thank you. Another couple questions? Yes?
So, if the health spot goes into a school or a hospital, does it require a certificate of need from the New York State Health Department?
That's an interesting question. I don't know, but I don't believe so because this is a standalone tool. It's just basically a means of facilitating initial exam. It's not a room, and it doesn't have any bearing on inpatient necessarily. So, but that's an issue, and I would probably need to look at that. But thank you for raising that. Yes.
You've talked about telemedicine. You haven't mentioned anything about teledental. Could you explain what the dental?
Yes. And I apologize for the oversight. Teledentistry is actually one of the faster growing applications right now. We have a lot of rural healthcare that lacks access to dentistry. And so telemedicine actually, what they can do is basic periodontal and cavity exams. They can look to see oral health, but it's still in its formative stage. Like telesurgery and teledentistry, there's a number of opportunities where surgeons can actually proctor a procedure that's being done, where they're looking at what's going on and supporting a local clinician. But dentistry is one of the faster growing, and it's been an area of great interest, and I appreciate you pointing that out, Justine. Any other quick questions that I can answer? Well, I'm hoping I answered everybody else's question. It is our hope that as a community, we will be incorporating telemedicine into some of the services that are now available here, working with East Hill and other organizations to sort of coordinate the implementation of healthcare services. We want to work with the hospital. We want to work with the local physicians. We do have interest from both Upstate Medical and from University of Rochester. So the opportunity to do this is here. It just takes a committed local stakeholder support to really bring this to bear. And I've worked with chambers of commerce around the country to sort of help promote these technologies in their communities as a way for businesses to be able to afford providing state-of-the-art care and access to care that wouldn't normally be available here in the community. So having said all that, and I tried not to be so fast that I rushed over it, but again, I'm happy to meet with anyone that has an interest in knowing more about telemedicine, and certainly working with Irv and the staff to sort of look at how we can offer this throughout Cayuga County. So thank you very much for coming today.
I do have to say one thing. I grew up in the days when the pediatrician made a house call when you were sick. After seeing your presentation, I really feel old now, Peter, so thank you very much.
They're doing home visits using this technology now. They just don't come to your house, but they use it to come to visit.
Yeah, but it's just a whole, it's like when you used to, how many of you are old enough to have watched the cartoon The Jetsons? Right? Doesn't it seem like what the Jetsons were doing way back then, and now it's a part of life? Anyway, thank you very much. That was very interesting. Appreciate it. This is the time when we'd like you to take out the raffle tickets you bought, because we are going